Preet Gill.
It's a pleasure to serve under your chairmanship, and thank you to the member for Warrington North for this important debate. 7 years after wage freezes and pay caps for public sector workers began, there is still no end in sight for millions of workers, many of them low paid and many of them struggling to make ends meet. When pay restraints first came in, workers like myself, understandably, were not best pleased about it, but many grudgingly accepted it. And not in their wildest dreams, or should I say nightmares, could they have foreseen that 7 years later such conditions would still be forced upon them. The very richest in our society have seen their wealth continue to grow, yet that growth has been matched by the number of people, including those in work, using food banks. It cannot be right that in the 6th richest country in the world, those who do some of the most important jobs in society feel themselves getting poorer every year. Kaylee, one of my constituents, wrote to me outlining her concerns. As a newly qualified nurse, Kaylee loves her job and is passionate about delivering patient care. Yet despite this, she finds herself questioning her decision to join the profession. Kaylee has spoken to colleagues who were forced to seek a second job in order to feed their children. She watched nurses leave their jobs for low-skilled jobs in restaurants as the stress of being a nurse has become too much, and even spoke to one colleague who had to remortgage her home as the rate of inflation had made it increasingly difficult to keep up to date with repayments. If young, passionate people like Kaylee are considering leaving nursing, then what does the future hold for our public services? Research by the TUC shows that the long-standing pay cap has meant staff such as nurses, teachers and civil servants spent 48 billion less on the high street since it was introduced in 2010. Across the public sector, there are massive issues with recruitment and retention of staff. And according to the Institute of Public Policy Research, in December 2016, there were an estimated 40,000 nursing vacancies in England, a vacancy rate of 11.1%, and 12,000 vacancies for healthcare support workers. And it is no surprise. Why would you want to go into a profession where you feel undervalued and are seeing a real terms pay cut every year? If we cannot recruit the nurses, the teachers, the local government workers that we need to provide the crucial local services that our constituents rely on, then the very fabric of our society is at risk. It is time to end the stranglehold on public sector workers, not just for the good of hard-working people like my constituent Kaylee, but for the good of our economy and the good of our society as a whole. It is time to scrap the cap. Thank you.